11th Annual C. Everett Koop New Hampshire Symposium on Addiction Medicine. This year we are focusing on harm reduction in an opioid era. We are sponsored today by the Dartmouth-Hitchcock Substance Use and Mental Health Initiative, together with the new and growing New Hampshire Harm Reduction Coalition, as well as the New England Institute of Addiction Studies, and a number of other sponsors. Which we'll talk about a little later, we'll be exploring what more we can do to reduce opioid-related harm that is really, as we know, devastated so many individuals and families in our state. My name is Seddon Savage. I'm a pain medicine and addiction medicine physician and education advisor to the Dartmouth-Hitchcock Substance Use and Mental Health Initiative. I'll be facilitating today along with Kevin Irwin, who is one of the founding members of the New Hampshire Harm Reduction Coalition. We're pleased to have over 200 people registered for today's meeting from across diverse professions. We have law enforcement, we have healthcare, we have educators, we have policymakers, social workers, addiction treatment providers, prevention workers, a really diverse cross-section of professionals in our state, and I think the size is a testament to how seriously we take these issues and how committed we as a state are to addressing them. A little later I'm going to review the goals of today and talk about the plan for the day, but first, another testament to our state's commitment to addressing these issues. We are really thrilled and very honored to have our Governor Chris Sununu join us to make some opening comments. And in deference to his very busy schedule and his willingness to be here, we want to move ahead with his comments. I wanted to share first how grateful we are for your work in this area. Governor Sununu, as many of you know, has really demonstrated very visible and committed leadership to addressing substance use problems, mental health issues, and the diversity of behavioral health challenges that we encounter in society. One of the very first things he did when he moved into the office, in addition to continuing the role of having a behavioral health advisor within the governor's office, he added a policy advisor really focused on supporting recovery issues. So we have the governor himself, we have David Mara as behavioral health advisor, Marty Bolton, who's known to many of us as a champion of addressing substance use issues. It's a great team in the governor's office addressing these. Governor Sununu has supported a recovery-friendly workplace initiative throughout the state. He has helped increase funding of the alcohol fund, which, as you know, addresses substance use disorders. He regularly participates in person at the Governor's Commission meetings, which is really refreshing and very helpful to all of us. He's worked on expanding capacity for treatment in the state, and he signed publicly our new syringe law last year, very relevant to our discussions on harm reduction today. So thank you very much for joining us, Governor.
Thank you. No, it's an absolute pleasure to be able to come, and I apologize we can't stay all day, but wanted to at least have an opportunity as you guys kick things off. A lot of key important steps, and I go back. I'll give you. I don't want to be repetitive, but I'll give you a little bit of the background. I remember that we talked a lot about this stuff over the past couple of years, and then as I came into office, I think within the first month or so was one of the first Governor's Commission's meeting. And Tim Rourke came in, and I think a lot of you know Tim, and the New Hampshire Charitable Foundation has done just incredible work on this issue. Long before I was here, long before a lot of folks were involved, they've really got on the forefront of this. And just having some of Tim's expertise was wonderful when he came in, and he said, so, he explained how the Governor's Commission's meetings go, and I asked him he said, well, do you want someone else to run it? I said, no, I asked him to stay on board. I think he's done it. He has subsequently stepped down, unfortunately, but he stayed very involved, and he just stepped down as the chairman. But I remember when I said, okay, so, I'll be at the meeting next week, and he said, so you're coming to the meeting? I went, well, yeah, it's the Governor's Commission. Like, I'm supposed to be there. He's like, oh, that hasn't happened. We don't, governors don't come to the meeting. Kind of weird. I was like, okay, well, I'm coming to the meeting. I don't know what to tell you. So, I think it's important, again, not that, and again, I don't take much, I don't want to take any credit. I'll take some credit, but the key is putting a good team together. right? In anything you do, in anything that's critical to the state or any critical endeavor. So you got to surround yourself with good people. The fact that we were able to bring in Chief Mara to really serve as our drug czar, the fact that I was able to get Marty in, someone who has lived and breathed addiction, not just personally, but in his professional life, and understands a lot of the things on the policy side of things, and really understands a lot of the pushes and pulls within the communities and the constituencies we're talking about, what we're trying to do in Concord. And this really goes for any issue, frankly, whether you're talking about public health or healthcare or education or the opioid crisis, mental health, whatever it might be, you've got to get to the grassroots, right? You've got to be able to talk to people that are like walking in the doors of the facility and talking to people that are providing the services on a day-to-day basis. What are the pushes and pulls? What are the stories? What are they hearing? What are they seeing? Because only then will the policies that we're changing up here really make sense to the individual. Right? I mean, that's the big challenge in government, I see. How do you make the $12 billion budget focus on the individual? It's easy to take the $12 billion budget and just keep throwing money at things and kind of stay up here at 30,000 feet and get nice headlines and all that. But really getting into the nitty-gritty of the policy to figure out what the pushes and pulls are. So when we talked about needle exchange, that's a great example where I said, okay, let me dive into it. And we read the research, and you know, Lord knows Marty and Dave just kept pounding research, and James Barra, who was in the position previously, just kept pounding information. We kept reading and digesting. We were talking to people, and finally we said, yeah, this makes really good sense. Let's just get this thing done. But sometimes we dive into the material, and I say, look, this doesn't make sense. I can't get on board for certain reasons. Also, when we look at the money, I think it's important. I mean, the money is a big part of this, as we all know. You know, we doubled the alcohol fund. That was a great step, and we were able to do it. It wasn't easy. It took a lot of, I don't want to say twisting of arms. I don't twist arms at the State House, but a lot of deep conversations with some of the House reps to get it done. But we did get it done, and that was great. But then the real trick now, again, it's not just how much money we're going to throw at it, how we're going to spend it. What's the accountability in the system? Or do we have duplicative efforts going on? Can we be more efficient here? Is there a program there that we're not looking at? Right? Is there a program here that's been funded, but it's just not getting the results that we want? How do we measure those results? All of these things have to come into play when we decide that we're going to really be serious about taking this issue to the next level. And that's exactly what we're doing. So in some areas we're pulling back on funding. In some areas we're doubling and tripling funding. In some areas we're creating new programs that have never even been thought of before. You know, the workplace recovery program is just really getting off the ground here. I think it's a great program, not just in its practical driver to get people back into the workplace, to get employers back comfortable, for lack of a better term, comfortable with understanding the pushes and pulls, the tools and resources available to them when bringing in somebody to their workforce that might have an issue, or might be going through recovery, or might have issues with addiction, but also using the business sector as the cultural change that we need. You can have all the passion in the world in this constituency, and if you're in this room, you get it. But you have to remember that 80% of the people out there aren't directly in this world right now, right? But we need them. We need them to understand it, to be part of that messaging, be part of that cultural change that has to happen here. And we want to be very proactive with the business community in doing that. And that's really where I see one of the biggest benefits of this workplace recovery program. Prevention programs. I've been pretty outspoken that I was not thrilled with prevention programs, especially in schools in this state. We're going to put more money in there, and we're going to try to do it in a new and more modernized way. Provide a core foundation for kids in all grades, frankly, and then the schools can build on top of that, right? Let them have their individual programs that can keep building from there. But you got to provide a core foundation so every kid has something basic that they can hold on to, that they can go back to in terms of what this crisis means. And we're doing it in a modern way. I tell a story, and I don't mean to go on, but I think this was really telling. We did a panel discussion on WMUR, and my philosophy is if we're going to have prevention programs for kids, they write the message. They're going to write the script. They're going to write the PSAs. We'll put up the money. But I might be the youngest governor in the country, but even I don't understand how millennials think. Are there millennials? Who's a millennial in this room? Raise your hand. It's got to be a few. Yeah, you're the smartest and most confusing people I've ever met. God bless you. Seriously. But I'm very serious about it. And part of it is what when I used to run my business, right? I had to figure out how to attract all different types of people to come ski at my old business. But attracting millennials we had a whole different campaign for that. You got to appreciate that, and that's fine. So what's going on in that world, how they address information, and when we brought these kids in from schools, it was myself, a few other people on a panel, and it was a really good panel, and we were just kind of asking questions. We were getting their feedback right on live TV. And about maybe a third or halfway through, this young man raised his hand and he said, look, I'm sorry. He goes, I know we're on live TV right now, but I just really found out about it. He's from Manchester. He said, I didn't realize what a crisis this was until about 6 months ago. And he said, you guys put a lot of ads on TV. He goes, I don't watch TV, and neither do my friends. And the light bulb went off to everybody in the room. You got to think about tomorrow, not about how we did it yesterday. How we message, what we say, how we're going to say it, and who says it is so critical in terms of getting real results. If you're going to talk about prevention or any type of messaging. So we just have to be more proactive about how we address this stuff, more ingrained, and I think, does it take more work? Sure. But, having forums like this when we talk about the public health aspects, right? We talk about the harm reduction of the needle exchange program. There's people talking about these safe injection sites, which I'm frankly not a fan of right now. I don't understand them, and I'm very concerned about it. Something that maybe you need to take up here. I don't know if that'll come up as a topic today. Full legalization of marijuana, that's the real hot topic right now. And we took, I think, some common sense steps, whether people agree or not. I didn't mind, decriminalizing. Right? We should be putting people in jail for having a little bit of marijuana. Bringing it to a violation level like other states do. I think that was a very common sense step. Right? We expanded the use of medical marijuana. A lot of people wanted it. I think it was a common sense, safe step. I think there was a lot of data that showed that it could be done safely and in control. People ask me, well, now let's just fully embrace full recreational marijuana. I said, look, we've made these common sense steps, but I got to tell you, as governor, I spent a lot of time, as many of you do, in treatment centers, in recovery centers, with families, with those who are fighting addiction. I've never walked in, and maybe there are some out there, I don't want to say there are none, but I can honestly tell you, I've never walked into a treatment or recovery center and had the staff come to me and said, and by the way, we really need to legalize marijuana. Just the opposite. One of the first things they say is, don't do it. Wait. Timing is everything. And right now for New Hampshire, we have the biggest drug crisis we've ever seen, one of the biggest public health crises we've ever seen. People said, now is just not the right time. And one thing I've asked Charlie Baker and some of the other governors, Governor Phil Scott in Vermont, they're about to undertake, they are sweating bullets. They really are. Because they just don't know how to do it yet. They don't know what the real repercussions are. They don't know how to regulate it. There's just a lot of steps here. And so I said, look, for me, it's not the right time. Maybe down the road, sure. But I think we have to really understand where we are, what that issue is, what the pushes and pulls are going to be. Can that come into play in terms of harm reduction? It may, and frankly, I'd rely on this community to help me truly understand and help the legislature understand whether that would make sense as something that's really viable. But to do it just to do it, when you're in the biggest drug and public health crisis the state has ever seen, I think the timing is not ideal. So a lot of things come into play. Doesn't mean we shouldn't talk about it. Doesn't mean we shouldn't have good conversations and understand the issue and really dive into this stuff, even if we're not going to commit to kind of certain final steps. But we better get ourselves prepared. Always think about tomorrow. Always think long term. Hardest thing Concord does to do in Concord is also get people to not to think in 2-year chunks, right? Because of the election cycle. Everyone always thinks in 2-year spurts because they're always thinking about the next election. That tells me they're thinking about the politics first. I have no patience for that. I really don't. We were very successful in 2017 in a variety of areas because we threw politics aside. And again, I'm not here to, you guys don't necessarily want to hear about kindergarten and things like that, but we have a lot of examples of me just saying, look guys, we have to do it different. Washington, God help you. I don't know anyone, the 4 congressional delegates, God help them for being down in Washington. I think that place is a disaster. I really do. What a mess. What a political mess. All the ugly discourse and the vitriol and getting nothing done because the politics get in the way of actually, what their job is supposed to be. We do it different here in New Hampshire. We really do, especially in this area. When you talk about drugs, when you talk about mental health and behavioral health, that's the last thing I want to leave you with. And again, I'm just trying to give you a framework of what our mindset is over at the State House. So when you come and advocate, when you come and have those discussions, I just want you to understand where we are. One of the other big issues I saw in the past year was we dealt with everything in silos. We talked about the opioid crisis here, and mental health was over here. And frankly, the state wasn't even doing much of anything on mental health. Don't get me started on that one. Behavioral health was over here. Abused kids was over here, and that was a crisis. We had to, frankly, just fire a lot of people and change management and really upgrade that. How we took care of the elderly was over here. Let me tell you something. They are all connected. They're all connected. It doesn't mean everyone with a substance abuse issue has a mental health problem, or vice versa. But they do overlap. We know that. It's called behavioral health, right? But we have to think that way. We have to think about what the domino effect will be when we start something here, how it will affect over here. I mean, we've talked about, in the Governor's Commission, we said, do we need to expand this? So it's really more a commission on behavioral health that integrates the mental health issues, because there's so many folks, there's just so much crossover there. I don't know if we're ready for that, because you don't want to dilute some of the efforts, but at the same time, it always has to be in the mindset. I do talk a lot about the mental health issue because I was appalled. You know, the state was sued in 2013, 2014 with a mental health lawsuit. And I went back and read that lawsuit. And you know what? We should have been sued. We should have been sued. It was appalling what happened under the previous administration. I'll be very blunt about that. It was appalling. And so I said, we're going to do something real. And I brought everybody in and said, we're going to put money at this thing. And we're going to bring in the best and the brightest. All politics thrown out the window. You know, folks like Lucy Hodder and Jeff Myers and a lot of folks that, you know, aren't quite the strongest of Republicans, but dang, are they smart in their field. They knew exactly what to do. And more importantly, they knew exactly where the problems were. And so over a series of a few meetings, we were able to line everything up and say, okay, if we do this and do this, then this will fall into place and maybe this will happen. Didn't all work out exactly as we want, but we're staying right on it. The next big challenge here, and what I want to leave you with, the state is going to face across the board, but especially for you folks in this room, workforce. Workforce. The unemployment number came out again yesterday. You see what December's was in New Hampshire? 2.6%. It's better than 6.2, but it's still a problem. It means we can't find enough of you. We can't find workers. We can't find nurses. We can't find clinicians. We can't find psychiatrists. Right? So we have to be very aggressive again. Don't just rest on our laurels. Be proactive. How are we going to go and grab that workforce? Right? So we're introducing $1 million, $1.5 million, maybe even up to $2 million if I can get the legislature to do it, in student loan repayment programs, which I think will be huge in terms of retaining a lot of the healthcare workers that we need. Right? We're getting the area agencies, the mental health agencies, more integrated with what's happening with the hospitals, more integrated with what's happening with the community centers, the federal centers on public health. So getting everyone integrated, getting a full head of steam, and going out and promoting, right? When was the last, I don't know if anyone here is from Boston, but when was the last time we actually ran an ad in Boston to remind people why they should come work in New Hampshire? Why a nurse should make a decision to stay up here, or move here, or why doctors should be up here, or why folks in the recovery field should be up here. We don't do it. We don't do it. We rest on our laurels. That is yesterday's thinking. We got to be very proactive. I was with, and I'm Sununu, I ramble on, I'm sorry. But I get excited. You guys get it. You guys really get it. And so I get excited. But I was over at Harbor Homes with Peter Kelleher, and we just opened up about 20 new transitional beds, really for mental health. First transitional beds in a long time. And again, I think we need about 40 more. I could go on all day about that. We have about 50 people at New Hampshire Hospital right now, ready to leave. They're ready to leave, but we have no place to put them. So the New Hampshire Hospital has basically become an apartment building. That's wrong. What a colossal waste of money and resources, and we're not doing them a service either, so we've got to get these transitional beds out there. But in part of that, I was talking to all the kind of the nurses, the staff was there, and a lot of them were millennials, mostly young women, a couple young men, and I said, I took the process that we're going to use on the prevention program in the state. I said, tell me what to tell your friends in Boston. Tell me what to tell your friends in Londonderry to stay here. Right? You guys need to help us drive that message. And it was great. Within 2 days, they sent me like 2 pages. Right? It was really good stuff I wouldn't have thought of, and I bet my team wouldn't have necessarily thought of. But now we can use that. My final point is this. That's what we need. We need your help. We need your advocacy. Your phone calls matter. Your meetings with reps matter. Don't think that you don't have a voice in the State House. I mean, I'm relying on it, and that's the tone we're really setting. If I get the same card, dear Governor Sununu, please do da-da-da-da-da-da, and with like 100 of those, you guys ever see those? You get the same card, but like 100 different people sign the same thing. I gotta be honest, I don't look at those too much. But when someone takes the time to write me an email, or pick up the phone, even though we might not talk one-on-one, although frankly, most everyone else has my number, my cell number in the state, probably should too, but someone in this room has it. But when you take the time to do that, it matters. And given the level of expertise we have in this room, the level of attention to this issue that we have in this room, we need you. We really do. So my final party message is this: stay engaged. not just within your community, but with us. Help us, right? I will never know, my team will never be as good, well, David and Marty might be actually, but I will never necessarily be nearly as a quarter as good as any of you in your field. We need your expertise. Doesn't mean we're going to agree on everything, right? Doesn't mean the timing is going to be right here and there. Doesn't mean we're going to be able to do everything that we want. But we got to make sure that discussion is evolving, and it only happens with your help, with your advocacy, with your letters, with your words, with the meetings. And again, I think we've made great strides this year. Look, for the first year, I'm not claiming any victory, but for the first year in a long time, our death rate is finally gone down in opioids, right? One is still too many. One is too many, which means we're going to be fighting this battle for a long, long time. So we have to be cognizant and mindful of that. But we are definitely making some strides, huge strides, I think, and we're being efficient. We have accountability in the system, and all these good things are happening. There'll be bumps in the roads, to be sure, but don't let the bumps thwart your efforts. Don't let the bumps get your morale down. Don't let the bumps think that we're not focused on the issue. All bumps are always a chance to learn, and a part of that learning process is getting your input over the state. So frankly, just we can be smarter and we can do better for the state. Thank you guys for being here. Thank you for being part of such an important discussion. Really, keep us on our toes and let us know how to make it better. Thank you guys.